We have a question today from Mary Claire, who's having difficulty getting her 5-year-old to bed. The boy is not wanting to go, has a million protests. I'm hungry, I'm this, I'm that, and also will tantrum at bedtime. So this is one where we want to do our basic bedtime method. So you're going to set a bedtime, and then before that you have to get the child, help them get ready, and they can, 5-year-old can get do a lot of that themselves. You may do a story or whatever. If the child doesn't cooperate with bedtime, then they're just going to bed at, say, 8 o'clock or 9 o'clock or whatever time you pick. This is a start behavior. We're not going to use counting, and we're not going to close the door and hold it. We might do that during the day with some children. But since there's a little hint of separation anxiety, you want to do the cut them off at the pass routine after bedtime. So after story and everything and it's bedtime, no talking, you're not going to talk to him anymore, and he's not leaving that room. So to cut him off at the pass, if he gets up, you can put him back, gets up, you put him back, and so on. After 4 times of that, we're not going to shut the door and shut him in, because he might be scared and that he's never going to go to sleep. The worst, if worst comes to worst, what you can do is you go in the room with him, shut the door, and let him do whatever he wants. You can't keep putting him back in bed. He can scream, he can run around the room, he can do it. You sit there, your presence is reassuring, but you're not talking to him, and he's not leaving that room after you're in bed. This can go on for, it can be quite a difficult routine, and it can go on for days and sometimes even weeks. But you need to know exactly what you're doing. So basic bedtime routine, cut them off at the pass routine. Don't shut them in and hold the door. If necessary, go in and stay there with him until he goes to sleep. Use a floor fan too. I forgot to mention that before. Floor fans help a lot.
Charting.
And charting with artificial reinforcers might be useful. So he gets a smiley face if he goes to bed well. Doesn't get anything if he doesn't go to bed well.